Sorry for the interruption. And yeah, going on to the prevalence, you have seen two pictures. One is going to tell about the overall prevalence of pelvic floor dysfunction, and of course, that is from UK population because standardized prevalence data regarding and related to pelvic floor dysfunction are still standardized in Western population, and in India, it's still being in a matter of research. So, as per that, as you could see, the order is from descending to the ascending one. One is going to be the urinary incontinence, followed by fecal incontinence, constipation, and pelvic floor prolapse or pelvic organ prolapse. Other than these all dysfunctions, there are a lot of other dysfunctions too, which are like especially like there are a lot of female sexual dysfunctions that are corresponding to pelvic floor issues in women, and those are again subdivided into sexual desire, sexual arousal, orgasmic dysfunction, as well as sexual pain disorders, out of which most of the women in the age group of adult, which is between in their highly reproductive age, that is between from 25 to 30 or 35, have a lot of experience with sexual pain disorders, whereas those women at the stage of 45 years of age or post 45 or postpartum, they have a high prevalence of sexual orgasmic or sexual desire dysfunctions. And we'll talk about the causes in the later slides. And to the left of the slide, there is something called level of bothering of pelvic floor symptoms. So what is this thing called level of bothering? Level of bothering is something like, what are the symptoms that bothers women? That is like these symptoms are going to bother those women. Excuse me. Sorry. These symptoms, like more women are concerned of incontinence, which means like leaking urine, or secondary to it, it is like dyspareunia. Dyspareunia is something like pain during sexual intercourse, or pain when having sex, or even a thought of sex may uh, bring up pain in them, and that condition is called as vaginismus, when it is accompanied with contraction or incomplete relaxation of pelvic floor. So when you want to have sex, your pelvic floor must relax. It should contract and relax. If there is no proper relaxation, then again it will result in pain. The other is obstructive defecation, which is otherwise called as constipation. Yes, it's not women. A lot of even children, they have a lot of prevalence. Constipation is of high prevalence even in children, and diet plays a major role in it. The least bothered are being pelvic organ prolapse and voiding dysfunction. And one of the most commonest cause of it is like people are not aware of what is organ prolapse or what is voiding dysfunction. Yeah, as associating with the function of pelvic floor, as Rati said, function of pelvic floor is divided into a mnemonic called 4SLP. Excuse me. Yeah, supportive role. When your supportive role is into some problems, you'll go into a condition called prolapse. It could be either a uterine prolapse or any pelvic organ that could prolapse out of your vagina. Sphincteric is like the control of urine or defecation, and when it comes, the most commonest dysfunction or incontinence, that is inability to control urine or an involuntary passing of urine or leaking of urine, and constipation is like there is problem with defecation. When it comes to stabilization, this is something that is an interesting fact that many women with low back ache, a chronic low back ache, or an SI joint dysfunction have proved prevalence of pelvic floor associated symptoms or pelvic floor associated signs. Most commonest is like either they may go for a tight pelvic floor, which would directly reflect over their sexual well-being. And when it comes to the sexual function, as I already said, there are sexual pain disorders as well as other sexual associated dysfunction. And lymphatic is because when you're not when you're a liquid, like what is like the body fluids are not properly draining, and sometimes it may even happen into your pelvis, and that may result in pelvic congestion syndrome. And posture, as Rati said, posture, pelvic floor muscles are one of the commonest muscles that are directly linked to the maintenance of posture because it forms an integral component of core. You, as social media is blooming up, and you know what is core. Your abdominals, your spinals, along with your diaphragm and your pelvic floor contribute to core functions. So core is one of the major muscle group that is going to contribute to your posture, and directly as well as indirectly, pelvic floor is directly, related to it. So this is like pelvic pain syndrome. Again, when it comes to pain related to pelvic floor disorders, it's like pelvic pain on a chronic go. Many women suffer from chronic pelvic pain syndrome, and it is like either because of the underlying condition. There could be something that is underlying. It could be endometriosis, or it could be an ovarian fibroids which is not being treated medically, or it could be a prolapse. Even uterine prolapse will have a complaint of pain, and if that is not treated properly, and if that goes into a chronic condition, many women will face chronic pelvic pain. Yeah, so these are the commonest dysfunctions that are associated with pelvic floor. Now moving on to how to manage pelvic floor. So I just want to question this to the forum, women or men. I don't want to give any gender biases. Yeah, you are like continuously checking your weight, whether I am in a normal weight or not. I'm looking fat, or do I look like is my shape in a figure? We are very much concerned. Yes, I am concerned about that. Same way, like sorry for my throat. Same way, if you're going to have a one pimple that is going to pop out, especially during your PMS, you just keep on checking in the mirror. So do I have a mark or something like that? So have you ever checked your perineum if that is healthy? I just want anyone in the forum to answer. Have you ever checked that your perineum? Have you checked your perineum, or if you checked your private part, if it is healthy or not? You can answer in the chat box, or if you wish, you can unmute and tell.
Maybe Mubeena, I think if you put it in another term, like instead of perineum, I think.
Yeah. Have you checked your genitals? Have you checked your genitals, or have you checked your private part? If everything is fine there, or have you even visualized it whenever you take a bath, or have you been into checking your external genitals? Is it normal or not? There is one yes in the chat box. So to be frank, if this question was for me, yes, we are taking bath daily, but we don't go into a proper private part examination, whether it is normal or abdominal. Do we have any infection over there? If there is any discoloration, if there is any problem over there, we don't check for it. We don't check it on a regular basis, like how we do for our weight, for our figure, or for a shape, or for a pimple, or whatever it is. Like it, one thing that I really want to suggest is that perennial hygiene is going to be the very first step to perennial health. The perennial health, na, it's like the health of your pelvic floor, or the health of your genitals, or health of the uterus, or something like that. So perennial health is going to be the very first step. Sorry, perennial hygiene is going to be the very first step for perennial health. So if you want to know whether I'm having a good perineum, or I'm having a good private part, I'm having a good genitals, you have to go for examination. And you can't depend on someone, or you can't depend on someone to do it for you. It's, yes, you can go for self examination, and that is called as mirror held self perineal examination, or self private part examination. So there are a lot of campaigns for self breast examination in the motto of reducing the complications of breast cancer, or to educate about breast cancer. So the same way, to educate about perineal health, to educate about pelvic floor health, mirror health self perineal examination is one of the easiest way. So that could prevent you from complicating the problems you have. Imagine if you have an infection, and if you feel a mild pain, sometimes, yeah, we would like take it for granted. It's just pain. It could be because of this. It could be because of that. And women, especially women, we could think, yeah, I mean, I may get my period, or it could be my premenstrual pain, or something like that. We may omit, or we may like leave off. We may not give an exact concern over that. So imagine if that would have been your infection, if that pain was a sign of infection, and you could find it by examining yourself. So I'm going to tell you how to examine your perineum by mirror held method. So you can opt any of the comfortable position. You can either go for lying, and if it is going to be lying, you have to choose an high head lying. You have to put a lot of pillows over your head so that you can visualize the mirror. So in this picture, right, she's lying flat, so that you can't visualize your mirror that way. So you have to raise your head in and lie such that you flex your knee and your hip. You can hold a mirror, and then you can look for your perineum. I'll tell what all to look. Same way, you can go for squatting, chair held squatting, or even you can use um, and sideways standing. So like you can put one leg over your toilet seat. If it is going to be a western commode, you can put one leg over your toilet seat and one leg down. Then go for a mild squat. Hold a mirror like how she is holding her hand. Imagine if that there is a mirror there, and then you can go for examination. So what all can you find, or what all should you do when you do a perineal examination? So before going to a perineal examination, you have to do your examination after urinating or defecating. You have to wash your private part using warm water. You have to pad dry it. Always use an hand mirror. You can't visualize your perineum normally. You have to use hand mirror, and that is going to give an visual feedback to you. And always go for a proper hand hygiene. Before you go for examination, have a proper hand hygiene. Use an hand glove, because perineum, or your private part, is one of your most sensitive area of the body, and very mild infection or a very mild cross infection could result of greater damage. So it is always better to use an hand glove, and I would suggest to wash your hand after as well as before your examination. What not to do? One thing is, most of the women will not be comfortable for going in for an examination, self-examination on their period when there is a menstrual flow. Do not check on bare hands or not following hand hygiene. And you should not go for perineal examination with long nails. Never go for it. There is another step called self-invasive examination to find your pelvic floor strength, which I'm not going to cover now, because it itself is a very big topic, and it is a very sensitive area of concern. So we are just going to go for an observational analysis. Like you have to observe. You have to observe if it is going to be for a woman. You have to observe your pubis. You have to observe. You have to observe your labia majora. You have to palpate your labia majora for any kind of tenderness or something like that. You have to palpate it using your fingertips. You can palpate your labia majora. Then open up your labia majora. Go and visualize your labia minora. Then check if there is any redness or if there is any pustules or something, something over there. If these are the signs of infection, your perineum or your private part is a normal. See, like how your face identity differs from person to person, your perineum also differs from person to person. It's not like there is nothing called a perfect vagina or perfect perineum. It will differ. There will be a symmetry. Sometimes people may have a symmetric structures over there. It is absolutely normal unless and until if you're not having any pain, uh, any irritation during urination, pain during passing stools, or any pus or an unintended discharge from the vagina or from the penis. Same way, men can also go for perineal examination. You have to go same way. You have to palpate your penis. You have to palpate your scrotum. You have to check if there is any discharge or if there is any redness or any pustules or small acne kind of things. There are a lot of acnes, especially vaginal or vulvar acnes are very common in women. But we won't have a concern in the, if it is in a concern in an early stage, it could not go for infection. Sometimes vulvar acne can go for infection, and if that is even not treated, it can go for a chronic pelvic pain disorders. So when you go for a perineal examination, you can find if there is any prolapse or if there is any infection. Even you can check for the scar health. If a mother, postpartum mother is going for a perineal examination, she can go and check her perineal scar. And other thing is that sometimes I would suggest, personally, I would suggest it's not just observation. You can do one test, and one that test is called as cough stress test. You can just hold your mirror, make your comfortable position. Either it can be an half squat or an pillow supported lying, and just hold your mirror. Take a deep breath, put like cough for 2 to 3 times, and check if there is any structure protruding out of your anus as well as of your vagina. Sometimes there is a type of prolapse where if you give stress, if you cough, if you take a weight, or if you sneeze, or if you laugh, such kind of stress, if you're going to give such kind of stress to your body, you'll feel a prolapse. And if you take out that stress, it will take back. That is one kind or a one stage of prolapse. It is mostly unnoted. You can't if you leave it as such, it can even go for an unreduced prolapse. This kind of prolapse where you give stress, and if you find any prolapse out of your anus or your vagina, that is called as a reduced prolapse. Taking up the stress could reduce prolapse. If that is not reducing, then it is called as an unreduced prolapse, and it would require it, which is stage 3 or stage 4, and it would require a surgical correction. So I just want to give an highlight on the alarming signs. If you find any of these signs, you have to go for a professional help. If you are going to leak urine when you cough, when you sneeze, or if you can't control urine till you open your washroom, or if you can't control your urine, even if you're going to undress and sit on a commode, and if you can't control, if you're like passing urine, then if there is any incidence of bedwetting. Bedwetting is common till 5 years of age, and if that is more than that years, then you have to go for a professional help. Then these are the left side. This picturizes what are the symptoms of a incontinence. Then when it comes to the picture that is in the center and down, it is like these are the symptoms of prolapse. If there is urinary incontinence, if there is pain during intercourse, if there is low back pain or unintended vaginal bleeding or vaginal discharge, it could be a sign of prolapse. And when it is coming down to sexual, one commonest sign that I would suggest for any sexual dysfunction in men or women is that if you are not feeling the feeling of satisfaction, sexual satisfaction, or if you're not feeling like your sexual tension is down, if you're not feeling that, there is something problem over there. And it could be anything. It could be either even psychological or it can be even relating to pelvic floor. If you feel so, please, if that is going to repeat as much as time you are going to have sex, or you're not completely comfortable in having sex, you have to go for a professional help. You have to go and consult a gynecologist. And if that requires a physiotherapist intervention, you have to go to them. Then again, low back ache and groin discomfort, pain in groin, pain in the low back ache, pain in the pelvis, or pain over the area where there is bladder, pubic symphysis, which means like the triangle area over your perineum. That is called as the pubic symphysis. If there is any pain over there, then that is going to be a reason behind chronic pelvic pain syndrome or pelvic girdle pain. So moving on to the next slide. Yeah, I said. So when it comes to perennial hygiene, one point I want to tell is vaginas are naturally hygienic. They don't require any special products like any scented products, any washes, vaginal washes, commercially available vaginal washes, etc. and etc. that are not required. But if you want to go for it, one suggestion is you can use anything over your outside part, but you can't use anything inside your vagina, because vagina is naturally acidic, and that is the status where you say vagina is healthy. If you're going to use any alkaline solution, yes, they will advertise like it is equaling to the pH of vagina, but we don't know whether it is yes or no, or what is the truth behind that. Warm water, not even hot water, warm water is the best choice of perineal hygiene to wash your vagina or even your penis or anus. And whenever you're going to wash, make sure that you're doing it from front to back and not from back to front, which means like you have to wash it from vagina to anus and not from anus to vagina. If it is from anus to vagina, there is a chance of bringing infection from your anus to that of vagina. Naturally, vagina and perineum is a very wet part, so very small amount of microbes can cause a very high amount of infection. So these are the things that I want to cover on perineal health. So moving on to the perineal pelvic floor dieting, there is nothing called a specific diet for pelvic floor, but I have given a slide because make sure that your diet includes high fiber, high vitamin D, lot of anti-inflammatory and antioxidants, good hydration, and I would advise reduce the amount of caffeine and alcohol. I would advise reduce and not to avoid. Anything within the limit is good. High fiber is because if you have a lot of cholesterol and less fiber content, you're most prone for constipation, and high fiber diet is one of the best diet for constipation. Vitamin D rich food is because like it is going to maintain the integrity of the pelvic floor, And going on to the anti-inflammatory and antioxidant rich food, yes, you can go for anti-inflammatory and antioxidant rich food, and that is going to regulate your hormone and reverse such conditions like PCOS and etc. Good hydration. Hydration is the best key for any of the issues in the body. When you're not hydrated, your body is going to reflect it. And to make it even more very clear, hydration, water is going to make your muscles more flexible. When there is reduced water content, as you know, how your biceps, how your abdomen core, how your quadriceps, how your calf is going to get sore, your pelvic floor muscles will also get into sore. And pelvic floor muscles by nature are very minute muscle, very small muscles, and they are like more prone for soreness. So have a good hydration. Then when it comes to caffeine and alcohol, there is two go. One is like when I have caffeine, when I have caffeine, I'm not going to go into alcohol. Alcohol, I'll tell like if you are interested, you can have it in a proper amount as per advice of healthy advice. I'm going to comment only on caffeine. Caffeine, when it comes to caffeine, yes, you can have caffeine, but make sure that it is not too much, because too much of caffeine is actually going to increase the amount of anxiety. So when you have a caffeine, you already have this thing called I'm very enthusiastic, I'm very brisk. So that thing is like, it is also promoting to one such condition called anxiety. You'll always feel a kind of anxiety, and especially when you're on your period, having caffeine will increase your anxiety. And the second go, that increased anxiety may create a stress, and that stress may increase the threshold. I mean, like, may decrease the pain threshold. May you have an increased sort of pain sensation. So that's all about pelvic floor diet. Moving on to the physical activity, there is there are a lot of studies proving that pelvic floor physical activity is going to make your pelvic floor healthy. And yes, even I'm going to support it. Any activity, pelvic floor, it's not just pelvic floor activity. There are pelvic floor related exercises too, pelvic floor specific exercises too, which will be having an activity as of now, if time permits. Physical activity is going to promote health, and same way physical activity is going to promote pelvic floor health too. I would generally recommend you to include some sort of lifestyle modifications that would include pelvic floor activity. If you're not a person who is into fitness or who is into a daily based exercises, you can just make this shift. Use steps instead of using lifts. At least once a day. If you're going to climb up and climb down, make sure one time you climb up and one time you climb down. The other time, if you're not feeling to use steps, you can go for the lift. But at least make sure at least once a time, once a day, you're using your muscles in an ample amount. See, walking is one best way to engage your core. Walking is one best exercises for your back pain. So it's like if you're going to engage your core, indirectly you're going to engage your pelvic floor. Engage in the sense you're going to activate your pelvic floor. So thereby you're going to give some amount of exercises to pelvic floor. So when it comes to conditions like incontinence or vaginismus or an tight pelvic floor or a loose pelvic floor, there are pelvic floor specific exercises that is again has to be prescribed concerning to the person. As you have prescription for a tablet, as you have a prescription for any other musculoskeletal exercises or cardiac exercises, you have a proper prescription for pelvic floor exercises too, and it has to be tailor made for each person concerning to their problem. It is not like hold the contraction for 10 seconds and then relax, and that is going to work for all. Never ever. That is not a good sign of doing pelvic floor exercises. And there is an other thought over exercises, like some exercises, like most of women come and ask, I do a lot of skipping. Is it like if I do a lot of skipping, my pelvic floor gets weakened? Like, will my pelvic floor get into a weak thing? Yes, it will. But if you have weak pelvic floor, if you have an already weak pelvic floor, and if you're doing a high intensity exercise training, for example, high level aerobic, high level fitness, high intensity training, or exercises like skipping or jogging on a higher intensity, it will result in pelvic floor weakness. So always make sure that you test for you have a proper, you check for your pelvic floor strength along with all the muscle strength, and then go for exercises. And make sure that you're addressing your pelvic floor from all the aspect, and it should be like
Excuse me.
yes,
Um, Sorry, I'm interrupting you this.
yes,
Since you were talking about the exercise part, so I
yes,
would like to hear one point, and I am also a pelvic floor physiotherapist.
yes,
That is why I am interrupting you, because before moving into another part, that people those who are doing high impact exercises, or be it in your gym, or your if you are in sports, or even at home also while lifting your baby or something like this. So so people have the misconception that they altogether stop doing these activities, while pelvic floor physiotherapists are expert in managing the pressure. So you don't have to stop, we simply modify the exercises. So so those who are expert in pelvic floor physiotherapy, they can help you in managing your activities, in your daily lifestyle activities also, and during your gym and sports also.
Yes, exactly. And that's what I told.
Yeah, that's it.
We have to address your pelvic floor before you go for any sort of activities. And yes, if there is any sort of symptoms corresponding to your pelvic floor dysfunctions, you have to go for a pelvic floor therapist. As rightly as Mrs. Indu said, like, you have to address. Pelvic floor therapists are really very well versed in addressing, managing pressure, which are the cause of most of the dysfunctions associated with the pelvic floor. Thank you, Indu, for adding up that insight. And it's like, if anything related to pelvic floor, it is mandatory to address it from all point of view, because any other dysfunction, may it be musculoskeletal, neurological, or cardiac, it is not directly linked to the social, mental, spiritual, as well as emotional well-being. Whereas pelvic floor, when there is any problem in pelvic floor, maybe incontinence or maybe in sexual dysfunction, all these things are directly linked to these components. So it is always better to address it from all the components, and that is why pelvic floor rehabilitation requires a multi-team approach. It's not just the gynecologist, not just the physiotherapist, not just the psychologist alone can do everything. It is always a team, a group, a medical care professional team that would give a better outcome for the patient. So PCOS and pelvic floor dysfunction, as Rati already said, hormonal influences has an effect on pelvic floor. And when it comes to PCOS, there is going to be irregularity in the hormones that are directly linked to the reproductive cycle, as well as indirectly linked. And thereby you have to address those who are with PCOS. Women who have PCOS, they have to address to the pelvic floor dysfunctions. They have to have a note on any of the symptoms that is occurring. May it be a sexual, more commonly sexual dysfunctions are very common. So they have to address for the sexual dysfunctions as well as symptoms like incontinence and etc. So yes, I'm coming to the end of my presentation. So all the women as well as men, may God feel proud for choosing you to be women, and for men, may God feel proud for choosing and women to be women. Thank you, and Joshua sir, thank you for the opportunity, and thank you Radhi for giving a brief introduction so that everybody can understand my other half of the presentation. Over for questions. We have 5 minutes of time, and over for questions.
Thank you so much, Mubeena and Rathpriya. It was an excellent session. So I think we have 5 more minutes or 2 minutes more to go. So if anybody has any questions, please, you can ask now, or you can put up in the chat box.
Hi there, I'm Chaitra. I have a quick question on the weak pelvic floor muscles, right? So if one has a weak pelvic floor muscles, will it be leading to the constipation?
Yes, it would lead. It may lead actually. There is something called coordination between pelvic floor. Pelvic floor is actually divided into two components. One is going to be contributing to the urination part, and the other is going to be defecation part. All these muscles, one sort of muscle is going to be responsible for this, and the other sort of muscle is going to be responsible for this. Those women who have weak pelvic floor, that is actually not weak pelvic floor. That sort of dysfunctions are called as incoordinated pelvic floor. When women, or when their pelvic floor is not able to address the amount of pressure as well as the like coordination of function between the urogenital and the anorectal diaphragm. So yes, they may have.
Okay, thank you for addressing that.
Thank you so much. So maybe we can wind up the session, and we will share our email IDs. If anybody has any queries, you can post it up. We will take the help of the speakers in answering it back to you. And thank you so much to the participants for your effective participation. And even though we had trouble during the session with internet connectivity and everything, thanks for staying throughout. And hope you all had a good session. And very soon we'll meet you all again in another webinar. Thank you again to the speakers, Ms. Rathpriya and Ms. Mubeena. Thanks a lot, and see you soon. Bye-bye.
Thank you.
Yeah.
Bye, sir. Thank you all, and have a good evening.